Hi, Dr. Josh Halper, Hillview Veterinary Clinic, and today's topic is the physical exam. Tessa has volunteered to come out from her very difficult duties of being the kennel manager to help me with the physical exam. It's real important that you have a general idea what's going on with your pet, from day to day, or from, what's going on overall. And I wanted to go over some basic physical exam that you can do at home, or if you have questions or if you don't like what you see, you can always call us. So what we normally start with, I usually start from the nose and work toward Tessa's tail. And so what you want to do is kind of look at your pet's face and see if it's symmetrical. Make sure there's no swelling or enlargements or lumps or bumps across her nose and face. And then you want to take a good look at her teeth. You see how nice and glistening. We'll discuss teeth in a later segment. But you want to raise her lip and take your fingers, and her gums should be warm and moist, okay? There's a lot of old wise tales about the nose. The nose should also be warm and moist, okay? So Tessa has good color. See how nice and color? You want to take your finger and you want to kind of push on her gums, and if you can see, her gums fill right back up within 1 or 2 seconds. That's called capillary refill. That just tells you that her heart and circulation is doing well. Take a look at her eyes. You see there's a little bit redness to the white part of the eye. That's normal, and they should be symmetrical, and the same thing here. So roll your eye back. The eye shouldn't be swollen. It shouldn't be red. There shouldn't be any discharge, because that's always an area of concern. So make sure her ears are clean, and what you want to go through is essentially look. Tessa's ears are a little dirty. I left this purposely and see how dirty it is. So I want to grab a little Q-tip and show you. And Tessa notoriously, labs and other breeds notoriously get dirty ears, but what I'm going to do is get a little segment here and see the black dirty. This Tessa needs her ears clean. This is not necessarily an infection. This is just, no, Tessa, you can't eat that. This is not necessarily an infection, just needs a good cleaning. And Tessa, I think we clean our ears 2 or 3 times a week, right, sweetie? Okay, so but really important, if you would raise the ear and get an odor, and then that means there's something going on. And we'll address the ear in a later segment. So, and then go over, look at her coat, and look at your pet's coat. It should be nice and glistening. And if it's not glistening, if the hair is falling out, you need to call us, because maybe you need nutritional changes, supplements, or maybe even a diet change. Very important. I'm going to listen to her heart and lungs with a stethoscope. You guys can pick these up at home, or you can use your hand. You can actually take your hand and put it right over her chest, and you can actually feel your pet's heart rate or heartbeat. Okay, normal heartbeat is pretty consistent. It should be 60 or 80 beats per minute. If you want to count the number of beats per 15 seconds and times by 4, that will give you her heart rate. Okay, let's take a little count here. $72. Perfect. So essentially I counted for 15 seconds and times by 4 when I got 72. So Tessa's in good shape. You want to check the hair coat and make sure there's no scaling or scratching. We'll discuss hair coat and dermatology later on. But you want to kind of look back and look at Tessa's rear legs and tail. You want to comb through. You can get a nice little comb, or you can buy these in the pet store or from us. This is a little diagnostic comb. Essentially comb through, and your comb should run right through easily. In an average dog, any time of the year, you should get some little fur. Labs have much more fur; they shed all the time. But it shouldn't be dirty, it shouldn't be scaly, and we'll address fleas and dermatology in a later segment. But essentially, that's it. I mean, and we'll talk about weight and obesity and how much to feed your pet in a later segment. But Tessa was a great patient, and she's happy to cooperate, because we get to she gets treats later. So. Signing off, Dr. Josh Halper, Hillview Veterinary Clinic in Reynoldsburg, Ohio. Thank you.